Welcome back. It's 9:43. More and more people are going under the needle for Botox. From men to millennials, Botox is proving very popular these days.
So what are the benefits, the drawbacks, and is it right for you? Joining us, the Botox Basics, Skin Sisters Lauren Sundick and Brooke Moss. Ladies, good morning. Good to see you here.
Thank you. Good morning.
Thank you. Let's just start right out the gate. You guys are here we go. Physician's assistant when it comes to
Dermatology, all things skin. Yes.
There we go. Basically, you're medically trained to do this, and you know what you're talking about.
Correct.
What is Botox?
So Botox is it's a medicine that blocks the signaling to your muscles. So it blocks the muscle.
Paralyzes?
Let me start over. Well, it doesn't paralyze, but it blocks that signal that tells your muscle to contract. So instead of raising your forehead over and over, which can lead to deep lines, Botox doesn't, when done correctly, doesn't take away that movement, but it slows it. It blocks it so the muscle doesn't move as much and as repetitively.
Okay, so where can it be used? I know I have been treated for migraines a long time ago and had it, injected back here. I've, from experience, have used it, and I find that it's less is more.
Absolutely. So the most common places that we are treating patients with Botox, certainly like those little 11 lines between the brows, the horizontal lines that everyone gets on their foreheads. Oftentimes we're treating the little squinty crinkle lines, the crow's feet. But more and more, the off-label uses for Botox, we're seeing a ton of patients come in. We're treating their masseters, the muscles here where when you clench down, like if you're sleeping and you're waking up for headaches, with headaches, we can treat that muscle. The horizontal necklines here, pebbly chin, teeny tiny little vertical lines around the lips. There are tons and tons of great uses for Botox.
So let's talk about, big elephant in the room. How much does it cost? Like, I know each person is going to be different, but what's the range here and how long does it last?
Great question. So Botox is very individualized. When done correctly, every person gets a different dose in different places, really depending on the needs of your muscles. It can be as little as $200 or $250 for a super light treatment. We have 25 to 30-year-olds who are getting just the littlest bit of lines at rest on their forehead, and they want to get ahead of it, still staying super natural, but really preventing wrinkles at rest. And then the price goes up from there. Botox lasts 3 to 4 months on average.
Okay, and there are things that you should not do before you get Botox that I know can probably, Brooke, maybe increase your chances of bruising.
Absolutely. So when we see patients in the office for Botox treatments, we make it really, really comfortable. We offer ice and have patients ice beforehand because that can reduce the slight risk that there is for bruising. We use the teeniest, tiniest little needles. Sometimes there's just a minuscule little pinpoint bruise. Avoiding things like alcohol, fish oils, aspirins, things that can thin your blood out, you want to avoid for a day or two before your treatment.
It seems, correct me if I'm wrong, but it seems there are a lot of options out there. You hear about Botox, you hear about all these other different things. Obviously, we're not saying anybody needs any of this, but if this is something you're kind of thinking about, who is it right for and who is it not right for? Is there kind of category where maybe you want to look at something else, or this is perfect for this type of person?
Yeah, so Botox is right. In Botox, Dysport, there's many brands out there. But it's right for someone who wants to either help prevent lines at rest, kind of freshen up, smooth out their skin, or even help to heal lines that are already there. We don't treat women who are pregnant or nursing. There are certain neuromuscular conditions that we'd avoid treatment in people with those. But otherwise, it can be really appropriate for men, women. We're treating patients between probably 25 and up, 75.
25 and up.
There's really no perfect age. It depends on the person's muscle activity and their skin.
Okay, so you said there are certain patients that you don't treat, like for instance, women who are pregnant, which makes sense. Let's say you have treated, or someone receives Botox, and it's too much. First of all, how do you know if you're getting too much because you don't see the results for a couple of days? And is there anything you can do if you're over Botox? Because I don't think most people want that look.
Sure, that's a great question. And our kind of treatment strategy is always to err on the side of less is more. Botox does take about 2 weeks on average to start showing its true results. If you're moving more than you want, we can always add more. But once Botox is in the body, it metabolizes slowly after those 2 weeks, like Lauren said earlier, in about 3 to 4 months. So after that product has been metabolized, you're right back to baseline.
I think too, maybe it's changed a little bit, but to your point, Alex, I think a lot of people have this idea of, you think Botox or whatever, in whatever form, for a lack of a better term, you think kind of like Real Housewives of fill in the blank, where it's just crazy and the lips are huge and not real looking. Have we gone away from that? I mean, that obviously is still there in some capacity, I would imagine, but that's not the goal, right?
No, we strive for supernatural looking. Like, our best outcome is you look just like yourself, but on your best day, right? You got 12 hours of sleep, you went on vacation, you're feeling like yourself. Maybe we turn the clock back 5 years, but certainly not 15, 20 years. We want to keep people looking natural and really take that preventative approach. Certainly there are, cases that we see still where it's Housewives-esque, but that's not the aesthetic we're looking for.
I would think that's important to talk to as well. The person who is going to be administering your Botox is to explain to them really what you're going for. You don't want to look like a cyborg and not have any expression, because I think we're getting more and more away from just having natural expression, and that it's okay to have some wrinkles, but maybe it's just, if you're really tired, it doesn't show quite the tiredness as maybe it did before.
Absolutely. I think that in general, we are moving away from a completely frozen look, for lack of a better term, and people are utilizing these, minimally invasive in-office procedures like Botox injections as part of self-care, feeling your best, looking your best, and we do it in a really natural way. I hear often, we'll treat a patient, they'll come back in for a 2-week follow-up and say, okay, well, no one asked me if I had Botox, but everyone asked me if I got my hair colored, or everyone asked me if my shirt was new. People perceive that something's looking fresh and updated, but no one's gonna look at someone with well-done, well-placed Botox and say, hey, did you have your injections 2 weeks ago?
There you go. That would be an interesting conversation. For sure. Lauren and Brooke, thank you so much.
Thank you.
Interesting, just topic of conversation for sure.
Absolutely. People
Thank you
more
so much.
informed. You can find this on Instagram at the Skin Sisters. The two of you are on Instagram. All right.